All right, good afternoon or good morning, depending where you're at, everybody. I am Dusty, one of the co-founders of Cowork Health, and I am super excited to have our guest presenter on today, Joanne Beyer. I'm going to introduce her here in a sec. I'll probably give just 10, 20 seconds as people's computers catch up and get them into the room. But I appreciate you all jumping on. I do want to highlight that there should be a chat where you can ask your questions if you have any, or snide comments if you want to make fun of me or something. You sure can do that as well. But please ask your questions. You can ask them as they come up. We might interrupt ourselves and answer them in real time, or if not, we'll try to answer a few at the end of the session as well. All right. With that said, Joanne was the managing director of Ahmed at one of the largest Ahmed / urgent care groups in the country. She helped build and manage one of the largest Ahmed programs in the Midwest while she was there. That group served multiple states and had over 8,000 corporate clients. She has extensive experience in client retention, service, B2B sales, regulatory processes, and operations management. And I do want to be clear that Joanne and Cowork have absolutely no affiliation. We are just both professionals in the occupational medicine space that love and want to contribute to the Ahmed space. And so that is why Joanne is here today to hopefully deliver some value to you all. That's something you can bring back to your groups to help you out. With that said, Joanne, I will hand it over to you.
Thanks, Dusty. Hi, everyone. Thanks for joining with us today. After 30 years in the Ahmed industry and reading thousands of client surveys and employer service check surveys and employer service calls, there are four things repeatedly over this period of years and years that keep showing up in client surveys and commentary when clients are getting back to us, letting us know how they feel about us, our services, good and bad, unfortunately. But those things today we're going to talk about. The first one is quality. Quality is implied. You are a licensed healthcare facility with licensed providers, trained clinical staff. It's always implied because you have that organization that you're running and managing. It's implied until the client has a reason to question it. When they start to question it, and it could be something as simple as a mistake on a physical, a missed prescription on a safety sensitive job for placement issues, a fatal flaw on a drug screen by one of your clinical staff. Of course, the biggest one, OSHA recordability on a workers' compensation claim that could have been avoided. Those are the things that really touch that heart and base of those corporate clients, and it really seems to get underneath their skin. So some of those things that you try to implement with all of the issues that we're dealing with in this day and age of staffing shortages, unable to find qualified staff, some of the things that they always stress to us is they want to make sure that when they choose a clinic for their Ahmed needs, that they have providers that are properly trained to do Ahmed. They want someone with experience in pre-employment exams, DOT exams. They'd like to know that your clinical staff has the proper training and certifications to perform those needs that they have, like DOT drug and alcohol screening, just regular drug screening, regular alcohol screening. If they're the kind of people that have certain Ahmed exams under regulatory issues, do you have NIOSH certified technicians for spirometry or PFTs? Those are the things that are important to them. It's hard. Everyone's trying to get qualified people, and those things are more of a challenge now than they were in the past. However, when you do have those people, and even if you don't, and you're training people as they're onboarding, because most of you are probably running an urgent care and you're using Ahmed to supplement those slow times and offset that revenue when urgent care is slower. You have to have someone in your organization that is monitoring those individuals, both providers and clinical staff, so that you have retraining processes in place for both of those groups when those errors come up. HR people move around at a much faster, rapid pace among employers now than they did 10 years ago. It's nothing for for me to have had a contact person that was at 4 or 5 different former client offices in 2 years. They bounce around, and when they bounce around, they do talk. They talk very liberally about their past ACMED clinics, both good and bad, and what they experienced in using those clinics. So those are the kind of things that employers would like to minimize. They don't want to hear about the bad. They like to hear about the good. They never let you know about the good, but the one thing you want to prevent is the bad. So, in saying that, if you're able to get those providers that have some specialized training, one of the things that employers resoundingly said to us is, we'd like to know more about the people you have working for you, especially on the provider side. So, we always talked about putting provider bios on your website with a picture. A client likes to see who their people are going to. They like to associate just that name with is it a male, a female? What kind of training did they have? Where did they get their schooling? And if they have any special credentials or training, that's very marketable for you and clients like it. You need to have that stuff on your marketing materials as well as any special awards or acknowledgments that your clinic or group has gotten from either the local community, any kind of surveys, things like that. That's very important. No one else is going to boost your reputation other than yourself, unless you have clients posting things on your website for survey results and they're boasting good things about you. But you're the ones that have to let everyone know how good you are, how good your staff is, providers, clinical staff, your x-ray techs. You're the people that have to say, come here because we're good, give us a try. So also on your clinical staff, it's important, you don't need to put their pictures and their bios on your website or your marketing materials, but what is important is, are they trained and certified in that DOT, drug and alcohol testing? Do they have NIOSH certifications? Clients need to know that, because now clients are becoming more educated in the realm of occupational medicine, and it's probably because more HR people, more safety personnel, they're having to take on more roles, just like all of you in your clinics. You're doing more now than you ever have. They are also doing that in their facilities. Budgets have been cut, cost-cutting measures have been taken place, and they need to take on maybe 2 roles or 1.5 roles. So they're becoming more educated in the safety arena and what is necessary for them to fulfill their duties as an employer in the regulatory space that they do work in. Client medical concerns on services are really important. We found that a lot of clients would send us back information, or if we were on the phone with them, they wanted to know if they had a concern on a medical service while the patient was in the clinic and they saw something on the paperwork after the fact. Who do they speak to? Is there someone in your organization, maybe a medical director, maybe a senior provider? Is there someone in your organization they can reach out to? The one thing that they don't want to do is have a medical concern, maybe about the way a patient was treated, and they don't want to call the clinic or reach out to say, well, let me leave a message and we'll have someone get back to you. If you could, I know that you're not going to be able to talk to a provider at that time. However, if they can say, we can have our medical director or our senior provider, we'll give them a message and we'll let them know that you need to speak to them. That's the kind of attention and how do I want to say that? That's the kind of attention that the client needs to feel important. They know you're servicing other clients, but they want to feel that they are the only client you service. And unfortunately, that's the way you have to treat it when you have them on the phone, when you're dealing with them with their paperwork. They need to be number one in their eyes and in yours while you're dealing with them, but they want to feel like that at all times. It's very hard for medical clinics to reach that kind of service level, because we're dealing with so many internal factors in treating patients. Let's talk a little bit about price. Price is always that factor that really no one wants to talk about unless you're a client. It's never going to go away. And some clients will only choose you by price alone and being the cheapest. Being the cheapest is not the best way to go. So one of the things you need to do is establish a standardization fee schedule that you can share when your salespeople or whoever your business development managers are going out and trying to solicit business. You need to have that standard for your most common services that you'll do in ACMED. You need to have that established so that your salesperson can share that with the client. On employer paid services, which I'll refer to as EPS, one of the things you need to know before you make your standardized fee schedule is you need to know what your competitors in your demographic region are. You don't need to be the cheapest, but you do need to know where you fall in that spectrum. Say you've got 5 clinics that are within your geographic region that would be competition for you. You need to know where you fall within that spectrum. It's important when you're trying to figure out where you need to be with your fee schedule. Being the highest priced clinic in the area gets you nowhere, but it doesn't mean that you need to underprice your services, because when you know where you fall in with that demographic competition, you know that you have a better chance of obtaining some information on them, and you can also use that to structure some new sales. When you have that fee schedule made, it's very popular to, when you're soliciting business to clients talk about this all the time. They would say, we really liked your willingness to work with us on some of your fees. So lots of times what a clinic can do is, if a client is stating that they're going to give you a large volume of work or potentially a contract for a specific term, you can use 1 or 2 of those service fees that you're going to do for them as a loss leader to gain clients' total business, meaning their workers' comp and their EPS services. When you can gain all of that business, that small discount that you might give on a TB or a pre-employment drug test or a couple dollar discount on a physical, gaining all of that work is more beneficial to you than just worried about the $2 or $3 discount you're giving them. But the one thing I will tell you, if you are giving special fees to a client, especially for a specified period of time, which the client and you have to agree upon, you need to monitor that business so you're not charging discounted fees after the time frame expires. And if the client is, especially on a contract, if they're telling you you're going to have a minimum of 100 physicals, 300 drug screens, if they're not meeting those minimums, and you need to watch that for the period of that contract, because then when it's up, you don't want to renegotiate those fees, because a lot of clients will say, well, we're just going to stay with that former contract and let's get that signed. You want to evaluate it to make sure that you're not undercutting yourself, because you need to be paid for what you're doing. When you're figuring out your fee schedule, your standardized fee schedule, you kind of want to know what your costs are so that you have an idea of where you're at with your break even. That's your fixed costs and your operational costs, just to make sure that you are sitting within that range where you need to be amongst the demographic competition in your area. Another thing that was important is you should probably perform yearly reviews of your fees and the fees of your competitors. If all of a sudden you're seeing a huge discount in your area amongst your competitors in drug testing, you know that the industry and the volume for the clients is probably driving that. You want to stay up to date on that, and you want to see where it can affect you and your business. Another thing is lab costs. They can rise rapidly. Perfect example, vaccines, hepatitis B, and those often get overlooked if you've got a standard fee and you don't know that that cost has been raised to you, because that's more on the operational side versus the ACMED side. If they're kind of running as separate business models, you need to make sure that you're not charging, $50 for something that your clinic is paying $90 for. That's very important. And on the work comp fees, you need to be very familiar with what your state regulations are. There's many states that have a standardized work comp fee schedule that's mandated. And that's important for you to know, because then you understand, how your billing is going and where those clients are coming in at paying that. There's always going to be the clients that'll base their total decision on price. But in today's market, with those clients struggling with retention, wages, staffing shortages, just like you, the more apt to choose a clinic that offers a full package, meaning price, quality, convenience. Clients like that one-stop shop. I'm going to say that a couple times in here, because That is reiterated time and time again on client surveys. We want a place where we can go and get everything done. We don't want to split up our services. We will if we have to, but we choose not to. Because when they have to split up their services among different clinics, it costs them more money, meaning they might get a better price, but it costs them more time. And time is money to them, and time is money to you. Let's talk about convenience. Convenience is probably the number one reason that a client will either stay with you or leave you. Um, here's some things that we found. We changed. Actually, I changed some of our operational issues and standards when we found that these things were starting to become more important in the last 10 years, 8 years, 5 years, and pre-COVID, and now post-COVID. It's extraordinarily important. Are you a walk-in or appointment-based facility? Clinics that offer both are better suited for multiple use amongst clients, and clients will tell you that. They like an option of appointments if they're a client that has a service that you're rendering to them that is a large service, large exams, service packages, firefighter physicals, huge pre-employment packages, hazmat physicals, asbestos physicals take a lot of time. Clients like to know that if they have those in that need, that they can call you to make appointments, because that helps manage the time that they have their people out of their office. It also helps you manage your backlogs and wait times, which we know time equates to money. Money for the client and money for you. So it's really important. Another thing is service. Does your clients know all of your Achmed capabilities? When they have to send a patient to another clinic other than yours, just because they don't know if you offer that Achmed service, that's a risk of losing all their business. Because once they walk in the door to your competitor, you've now let them open the door to hearing everything that competitor has to say. That competitor will find out they were using you, and now they're coming to them because they didn't know if you guys offer certain testing, certain vaccines, certain things like that. That client's going to do everything they can walking in the door. They didn't have to solicit that business. It costs them less money. All they have to do is try to transition the rest of their work. So they're going to try 10 times harder to keep all of their business, and you're going to try not to lose it, but it's going to cost you more money. So the one thing is that your front desk staff, it's really, really important that they know what you do. It's important that your clients know what you do. Have it on your marketing materials, have it on your hard copy, have it on your website. You know, people say less is more, and you don't want to have your website bombarded with so much data and so much material that no one will read it. But you can highlight all of those services you do under occupational medicine, because when a client knows you do it, they're more apt to try to use you for that. Like I said, they like that one-stop shop. Is it easy for you to establish a corporate account with a client? We heard clients tell us consistently, you know what, we had to have so many with our former clinic. We had to have 5 meetings, 17 phone calls. We're not into that. We don't have time to do that. Make it easy for a client to establish a corporate account with your site. If you have B2B salespeople or business development managers, whatever you choose to do your sales, or hopefully you have someone that you're able to do that with, at least part-time. Establishing an account should be able to be completed in one face-to-face meeting and no more than 2 follow-up calls, unless you're waiting on some kind of information for the company to get back to you. You should always have 1 or 2 people assigned to setting up accounts. And the reason for that is you need to minimize the number of people allowed to do this in your organization. And that helps with consistency and quality. For example, I've run into, in the last year and a half, I've run into a lot of clients that will tell me when we're talking about who's establishing their protocols in their corporate accounts, they've got multiple people in their organization. So I would say, what about standardization? Are those people that you're allowing to do that? How many do you have? And are they using all the same terminology when they're talking to clients? when they then put that information into whatever practice management system you're using, are they using the same terminology when they're keying it in? Because when they don't, and it's keyed in 4 different ways, how does the clinical people understand that? Does the provider understand it? Maybe Sally and Bob might have listed it this way, and Mary and Jill listed it some other way. You need to have that group kind of tightly controlled, like a centralized area for that. It's really important because the more centralized control you have on those client accounts, the better quality that's going to come out of those services and the better quality that the client's going to see. A client is not going to want to call you and say, hey, on this paperwork, I see you're calling it this. We sent in Mary for the same service, but on this paperwork, you're calling it something else. Clients don't like that disconnect. They want a one-stop shop. And it's very important for when your folks that are answering the phones that they're aware of all the services you provide and who should be handling any client inquiries. Time and time again, this was right at the top, probably 75% of the surveys that responded were, when we call the clinic, we need our call answered and we don't want to be bounced around. Bouncing a potential client around on the phone with an answer of, I don't know, that's a deal killer. They're not going to come to you. They're just going to hang up the phone. And if you have them on hold, they're going to hang it up. They're going to call the next clinic down the line and they're going to see if they can answer it. So it's really important to train that staff who's ever answering your phone. They need to know what you do. And if they don't know all those answers to those questions, they need to have one person or 2 people that can go ahead and answer that for you, because you want to keep that client contained in that one phone call and maybe one transfer. Is it easy for a client to send in a patient? Clients want to be able to do something electronically. So do you have and require authorization forms for clients to use? It's a good way if you use authorization forms to confirm services at the time of treatment. And later on, you can actually use it for billing quality as well. When a client says, well, we didn't authorize this, your billing department, whoever's doing your billing, can look at an authorization form and say, well, it was authorized on the billing. It was authorized for treatment. Here, we'll send you a copy of the authorization form from your group. That authorization form, too, should also have a way to get back to the client, a name and a phone number that you in the clinic, if you have any questions, you should be able to call that person filling that out. Authorization forms cut down on so many phone calls. It is absolutely amazing, but a client needs to know how to use it. Lots of times authorizations will be filled out by numerous people at a company, might be filled out by HR, safety person, supervisor, and some night staff if they run a double shifts or 24 hours. Foremen usually have them. The client needs to be trained on how to use it. That will save you time, money, and it will save you business, because when it's not filled out correctly, there's always a he said this, she said that. That's the kind of thing you want to avoid. Clients need to be accountable for some things. They just can't send in their employees with no accountability, because when they do that, it's a free-for-all. The patient ends up not getting what they need, and that's the first and foremost thing. The patients need to get what they need. The client needs to know that they're sending someone in for a service that they're paying for, and you need to know what you're doing so you can do it correctly and then eventually get paid for it. Clients want those electronic authorization forms more and more due to COVID. Like, everybody likes to use COVID in their talks. COVID kind of changed the way everyone was doing business, remote work. HR people, recruiters, a lot of them are all working remotely. They don't even see applicants anymore. They might do an interview on a Teams call or a web call, and they never see the patient or the individual face to face. So if they go ahead and want to make an offer, they want a way to send that electronically to you, the clinic, because they can email it to the patient or the prospective employee, and the prospective employee then has to be responsible and make sure they have it when they come into the clinic. But if you provide a way for that client to send you an electronic authorization form, you're way ahead of the game, because you don't have to worry about the patient bringing it in, you've got your documentation on what needs to be done, and the client actually loves it because now they can track it where they sent it, and they're not going to be worried about getting a phone call because a client walks in or a patient walks in and doesn't have any paperwork and doesn't know why they're there, because the patient will always say, I'm not sure why I'm here, or they will tell you why they're there and it's the wrong reason. You have to make sure that your billing is easy for the client. Billing's never easy, but no matter how much work you and your staff put into seeing patients and accommodating patients, you have to get paid for what you do. Otherwise, it's all for nothing. Clients tell us they want their bills, they want easy bills to understand, or invoices. Do you send them their bills electronically or by paper? Or do you offer either or, depending the client? The larger the client, they want everything electronically. Smaller clients still want stuff on paper. More and more clients want electronic bills. They want the ability to pay online. That's something to think about, because online payments not only benefit them, it gets it off their desk and they don't have to worry about it, but it benefits you because your days outstanding now are going to be much lower than waiting for a paper check to be cut by an accounting department, mailed out, and then once you get it posted, it can cut your DSO down dramatically, which is what you want. Do you have an easy way to send billing reminders and notifications for clients who don't pay regularly? Billing is just as important as providing the services or getting the new business. Like I said, if you don't get paid, everything else you do is for nothing. Lastly, it's communication. It's the key to everything with a corporate client. It's the key to maintaining long-term client relationships. It's the key for when a client gets upset with you, and they will. We're human. Everyone makes a mistake. Everyone. I've made plenty in my 30 years in ACMED, but if you've got good communication and the ability to talk to that corporate client, they have a tendency to trust you more. They will stay with you even after they're upset, after an issue happens, or they don't like the price, or there's a billing mistake, or a provider mistake, or their employee is complaining on the service they got. As long as you can communicate with your client will tend to stay with you longer. It's very important to have an established and consistent process for all clients when setting up their accounts at your facility, meaning procedures and personnel. They want that personal touch. Clients want a dedicated person. A lot of people, if your sites are not very big, I understand that that's probably not the reality in which you work your business. But if you have maybe a few people or a small department, if you don't have that individual client retention person, clients want that personal touch. They want to be able to call the clinic. They want to or call someone directly and say, this is my problem, help me. And if you can do that consistently with them on some kind of basis, working that within the structure of your staffing model, believe you me, that will end up saving you money in the long run. I know people think that we can't take someone off the floor, or we can't take someone in clinical out to dedicate, half of their day towards client calls, or a list of calls that they'll need to make back to a client who's called. Believe you me, that money that for that couple of hours that they're going to call those people back and take care of those issues is nothing compared to losing an account of $30,000, $40,000, depending how big you are, $100,000 account. It's very easy for a client to take their money and go somewhere else. And it's not easy for you to retain that business once you've let it go out your door. So it's very important. Clients want someone in particular or a department that they can reach out to when they have an issue. Educating your clients on your processes and procedures saves you time, confusion, and frustration. Your clients need to know what's required to send in patients, so you eliminate unnecessary calls to them. One of the things that they like to see, and that's kind of been as of late since COVID, they like to see if you have this availability with your software system, the wait times in your clinics. It's become more prevalent. Clients make more comments on it. They like to know if there is a 2-hour wait, an hour wait, and if you have multiple sites, checking on those. They might send someone a little bit further if there's a 20-minute wait versus at the clinic they normally use and it's got an hour and a half wait. Clients really like that and they make a lot of comments about it. Does the client know what paperwork to expect from you after the clinic visit and when results are reported? It's really important that you share that with them up front, that on a pre-employment, if they set up a pre-employment package with a drug screen or an alcohol test and a physical, it's important that they know what they should be receiving back from you and what it looks like. You don't want to send them 5 or 6 pieces of paper and then they're calling you saying, what am I supposed to have here? Am I supposed to have all of this? Am I supposed to have one piece of this? Where's my result? Where's my placement information? They should see that from the get-go, and it really helps them understand what they need. If you can eliminate their frustration, you gain long-term relationships. Do you have a simple way to communicate those results back to the client? Email, portal, faxing, more and more these days, and I'm sure everyone knows this, clients want a portal so they can obtain their results at their leisure, and they use it as a repository when they need to access them again at a later date. More and more clients want portals. That's all you hear. Of course, there are those clients that are smaller and they want, maybe mail it out. We still have those. Everyone still does if you service small clients. But more and more with the electronic version of exams and even the DOTs using electronic versions, that's where this is going. Another thing clients know that they like is a newsletter, but you need to have a way for them to opt out of that newsletter. You don't need to send them something once a month, once every couple months, once a quarter. Put things in there that are going on in your site. You're opening a new location. You're bringing on, you've hired a couple of new providers. You've got another certification. You've got more people that are certified in this test. You're changing your hours. You're going to be closed over a holiday. People like to know those things, but you do need a way to let them opt out because you don't want to just keep sending them things and they're frustrated and they never open them. Quarterly service checks are really important. Clients will tell you, I don't want to be bothered. However, when you get them on the phone, you're surprised. That's their opportunity. And they will say, we've been unhappy for 2 months and this happened and that happened. You were completely unaware. The client never told you. But by you reaching out with a communication factor, now you're able to try to save that account and deal with the issues that that client has. Clients very rarely call you and tell you what a great job you're doing. But sometimes they call you and tell you what a bad job you're doing. Lots of times they won't. They'll just say, I'm done with this clinic. I can't deal with them anymore, and then move on. So those service checks, they're a real good opportunity to just give the client a little forum. Are you happy with the services? Is there anything we can do better for you? Things like that. Those are important. You want to reiterate too to the client, we have a point person or a team for your needs in case you are frustrated with anything, and you give them that point person's name and phone number or an email address. It's very appropriate that they email something and someone gets back to them, not in 2 days, in 24 business hours, unless it's an emergency. But they need to, it needs to be reiterated to them so they know that they do have someone they can reach out to. All in all, well-informed clients tend to be the ones that are happier with your clinics. They tend to stay the longest with you. They tend to be a little more accepting if there's something that they're frustrated with. But when they've been with you for a long time and you communicate well with them and you understand their needs and you address their concerns in a timely fashion, those are the clients that will stay, and that creates recurring revenue streams for you in the long run.
Awesome. Thank you, Joanne. A ton of awesome content, like 30 minutes.
Thank you.
We'll make sure to send this out as a recording. This wouldn't be a webinar if there weren't a few technical difficulties. So I did get a number of emails popping up. So telling me they're having trouble getting in, a few of you joined late. So we'll make sure everybody that registered gets a recording of this as well.
Okay.
In just a minute, we will take questions, like 2 or 3 questions. If you all have them, please put it in the comments if you do. I will say, this is not meant to be a sales pitch, but we do want to provide value to you all. And so a number of those things that Joanne mentioned were exactly why we created Cowork Health to begin with. These are pain points we've heard. We've been in this industry for 15 years and have been trying to attack those pain points of communication, easy billing, digital authorizations, all those things Joanne kind of went through. We're trying to attack those to make it easier for clinics to manage. With that said, you can go to our website if you want more information. You can ping me directly and we can go deeper there if that's at all interesting to you. If not, no worries. We will take one or two questions. I don't see any pop up. Make sure to read the comments too if you're in here. Dr. Earl, he's president of NAOHP, and he has a lot of great information. He had a few good comments in the sections as well. But I'm not seeing any questions pop up. Any other points that you want to mention, Joanne, before we drop off here?
No, I think we've kind of covered, the basis. They seemed kind of simple, but in today's crazy world, sometimes the clients just like to know the simplest things can be taken care of. And it's all about reaching out to them and making them feel important and letting them know you're there for them. And I I have clients that have been with me for 30 years and they've been through frustration, and some of them appreciate what we do, but that's a long time to keep a client. And so when you kind of focus on what their needs are, it kind of falls in place, and hopefully that helps you build your organization and your business model.
Awesome. And if it wasn't clear, Joanne has a ton of experience. She is an independent Ahmed consultant. And so if you are looking for some assistance to either build an Ahmed program, refine yours, make it better, she might be a great person to reach out to and maybe get some more tips and advice
Thank
there
you.
as well. So we got my email address, we got Joanne's email address on the screen here. Again, we'll record it, but write it down quick if you want to ping us. And yeah, again, thanks for joining, and hopefully we'll see you in the next one. Thanks, everybody.
Thank you, Dusty.